Hello and welcome to DMACC's Associate Degree in Nursing Information Session. Today we're going to talk through the requirements of the program. We'll talk through the program checklist and just kind of go through some of the ins and outs of the nursing program. First, I want to take some time here. I'm going to minimize the screen and show you our website and show you where you can find some helpful information. First, if you just go to www.dmac.edu, up on the right-hand side here, if you just type in nursing and click on that first link that populates, you will get to this website here. On the nursing website, there is a variety of different things that you can find that will be helpful for you. First is the entry requirements. You will see those entry requirements are the same for each of the options that are listed below. I will, as we go through this information session, go through those various offerings for you, but here is where you can find that information. So the entry requirements are the same for each option. You see here then we have our Associate Degree Nursing Standard Traditional Track. This, as you see here, is our nursing courses completed in 2 years. There's no summer in those courses offered. Ankeny and Boone admit every fall and spring. Carroll and Urban are admitting every fall for that track. So you have that information there. Number 2, the Associate Degree Evening Weekend Program. This is a nursing courses completed in about 2.75 years. It is only one nursing course per semester. It does include evenings and weekends, and that is starting this March 2019 on the Urban campus. And then our Associate Degree Nursing Accelerated Track. This is nursing courses completed in 1.5 years. It's very accelerated, starting in the fall of every year on the Newton campus. So you have that information there. I'll go through those offerings with you further here in just a few minutes, but just so that you have that. Additionally, you see information here in this next little step. It talks you through the current, if you're currently an LPN paramedic or some military medics, you may be eligible for what we call our healthcare professional exemption. And if you feel that that may apply to you, you can click on the hyperlink and it will bring open for you that checklist. The exemption gives credit for term 1, which is ADN 110 and ADN 140 to students who qualify for that. It allows those students to start into the nursing program in term 2. So that is highlighted for you here as well. And then you have the practical nursing information, and I will discuss this here in just a little bit, but that is a separate information session. If that's something you're interested in, I'll tell you how you can get to information about that here shortly. That does have separate entry requirements, and you can link to those here. As it's mentioned here, those nursing courses take 1 year. It's a spring, summer, and fall term. It includes summer nursing courses, and the next track will be admitted on the Urban campus in the spring of 2020. So that is the information down the center there. Off to the left-hand side, there are many different things. I'll be talking throughout this information session about the ATITs. There's information located here that will further describe that process. There is the entry requirements are out here. The various faculty members, instructors, and staff can be located under this tab. Program contacts, frequently asked questions. There's some great information on our site here about DMACC Healthcare Simulation, which I'll be talking a little bit more about here as well. Scholarship resources, our RN to BSN 3+1 completion program. And then under our current students tab, you will find information about the requirements for CPR certification, graduation requirements, various health requirements, and then also our nursing student policy manual. On the right-hand side here are our upcoming information sessions. If after attending this information session you wish to attend a face-to-face session, you can review those dates and times off to the right-hand side here. If the registration is required, that will be noted for you, and you will have contact information for that. Please note that there are specific information sessions that are offered for the practical nursing program, so you'll want to make sure if that's something that you're interested in that you're selecting the appropriate session for your needs. So without further ado, I'll flip back to the PowerPoint here. So I want to highlight for you, just for a few minutes here, what separates DMACC nursing apart from other institutions that may be offering the same associate degree nursing program. DMACC was founded in 1966, and nursing was actually first offered in 1968. So it's been, the program has been around for quite some time. As a result of that, clinical agencies and employers know and respect the program. They're very well involved with our advisory committee on what the program looks like and what that offers to institutions with our students graduating and entering into practice. Our full-time faculty are all master's prepared, and many are either doctorally prepared or are currently completing a doctoral degree while they are teaching. In the clinical setting, our adjunct faculty have a minimum of a Bachelor of Science in Nursing, so they have that BSN degree. Many of them do also hold a master's degree. Our class sizes are approximately 24 per section, with our lab sections as small as 1 faculty to 8 students and no larger than 1 faculty to 12 students. Clinical groups are capped at 8, meaning there's a 1 faculty to 8 student ratio in the clinical setting, and that is in accordance with the requirements of the Iowa Board of Nursing. Not all nursing programs are accredited, but DMACC is accredited by both the Iowa Board of Nursing and ASIN, Accreditation Commission for Education and Nursing. This means that our curriculum and procedures meet very high standards. As students are entering into BSN programs and also looking at employment opportunities, many of those institutions will require that you must have been a graduate of a nationally accredited program. So we do hold that accreditation and find that to be very important for our students. Our NCLEX pass rates are generally at or above the state and national standards, and you can see the most recent quarter's outcomes listed on the website. Those little circles that were kind of at the top when I had that up just a few minutes ago, you can see what those are. That's updated as new data becomes available from the Board of Nursing. Our graduates and our employers are surveyed once our students graduate. Our graduates report very positive feedback. They're very satisfied with their education. They feel as though they've been given the skills that they need to enter into practice and begin their professional role as a registered nurse. Additionally, our employers, like I mentioned, are surveyed. They really do feel that our graduates can enter into practice, can prioritize and delegate and do the things that they need to do in their role as a registered nurse without any difficulty. So that is also very important. We do offer 3+1 opportunities. This allows our students to complete 3 years at DMACC. That includes their pre-nursing and their 2 years in the traditional track of the nursing program. Again, that may be shorter if you're choosing the accelerated option, and it may be longer if you're choosing the part-time option, but on average 3 years. And then they complete the following +1 at a partnering BSN school. Currently, we are partnering with the University of Iowa, Iowa Wesleyan, Purdue Global University, and Grandview University, but that list is continually being revised and new schools are being added as appropriate. So I want to take a few minutes here just to highlight for you our different options. I mentioned when I was on the website that there is a traditional track, an accelerated, and a part-time, but I want to take some time just to break that down a little bit further for you. So our traditional track includes the entry requirements plus 5 semesters. There's no summer nursing courses in this track. It is offered in Ankeny and Boone every fall and spring. Ankeny admits 48 students and Boone admits 24 students every fall and spring. Carroll admitting every fall up to 24 students, and then Urban admitting every fall, again, up to that 24 students. Our accelerated track is entry requirements plus 4 semesters, including the summer semester. It's offered on the Newton campus, and they are admitting every fall. And then lastly, our part-time option. This is entry requirements plus 8 semesters. It does include the summer. It's offered on the Urban campus with a start date of March of 2019. One important piece that I'd like to highlight here for students is that once you are enrolled and admitted to a campus, whether that is Ankeny, Boone, Carroll, Urban, Newton, whichever campus that may be that you choose, once you choose that campus and you begin in the curriculum, the expectation is that you stay on that campus. You may not transfer between campuses. So keep that in mind as you're selecting which campus you feel is the best fit for you individually. So I'm going to take a minute to go through our program option in the plan of study. And I'm going to minimize this for 1 second just so that I can pull up my apologies. There we go. So I'm going to pull up for you a little bit cleaner of a view so you can see. So I'm going to go through the full-time traditional plan of study, and then I will show you the accelerated and the part-time plan of study and just kind of point out a couple of the differences for you so that you are aware. So you see here in this block the pre-nursing entry requirements that are required. So in that, students must complete Bio 168, Anatomy and Physiology 1, Bio 104, Introductory Biology with Lab, Chem 122, Intro to General Chemistry, the Math 121, College Algebra or Math 157, Statistics, and Psych 111, Introduction to Psychology. Now, something to keep in mind, which I will bring up later, is that if you have not taken college algebra or statistics, you will be required to take an ALEKS math assessment. That assessment is free to you as students, and it really just allows the system to recommend placement into the appropriate level math course. So you will be required to take that prior to taking college algebra or statistics. However, if you've already taken one of those classes, you will not need to complete that. If you are trying to decide between college algebra and statistics, we often will encourage that students consider taking statistics because it is often required of most BSM programs. So you can take that here at the community college level and transfer. Once those courses are completed, along with the checklist items that I'll review here in just a few moments, you would then enter into Term 1. Term 1 in the traditional track includes ADN 110, Introduction to Professional Nursing. This course is a 5-week course, and it really hones in on a lot of items related to entry into practice. So the nursing process, we talk about professionalism and the importance of professionalism in the role of a professional nurse. We talk about the healthcare delivery model, different healthcare delivery systems, and we talk about communication among all of the people that are part of the healthcare system. So there's a wealth of knowledge in that first 5 weeks that really lays the foundation for the rest of your nursing education here at DMACC. Once that 5-week course is completed, students will go into ADN 140. This is Nursing Fundamentals. Nursing Fundamentals includes a theory, lab, and clinical component. As you see noted here, this course includes 90 clinical hours. Those clinical hours come from a variety of different places. It may be acute care, it may be a daycare, it may be adults with disabilities. The goal is that you have a variety of situations and settings in which you can apply care across the lifespan, so infants to adulthood, and really work on communication and also assessment skills in that course. So that's ADN 140. In addition, you see in that semester in red, and throughout this plan of study you see in red, your co-requisite courses. So it's important to highlight these courses must be completed in the semester in which they fall or the semester prior to, but if they are not completed by the end of this semester, you would not be allowed to progress on to the following semester. So in Term 1, you see Bio 173, Anatomy and Physiology 2, and English 105, Composition 1. These two courses, along with those nursing courses, must be completed with a C or better in order to move or progress on to Term 2. In Term 2, you see ADN 210, Advanced Nursing Practice, and ADN 240, Health and Illness Concepts 1. These two courses in Term 2 in the traditional track do happen simultaneously, meaning you're taking both of them at the same time. ADN 210 is a theory and a lab course. You're learning many of the skills that are needed to enter into practice as a registered nurse within that skills course. And in ADN 240, you have a theory and a clinical component. ADN 240 is comprised of 135 clinical hours. So for those that like numbers, as you kind of go through adding up these hours, we have a total of 675 clinical hours in our curriculum. So that's also a value to you as a student. So 240 has 135 clinical hours. It's a combination of OB clinical and also acute care, inpatient, medical, surgical, clinical. Additionally, in this semester, you see Psych 121, which is developmental psychology. Again, as a reminder, that course must be completed in that term or prior to that term, but failure to complete with a grade of a C or better would stop your progression in the program until that was completed. Next, you see Term 3. Term 3 is a summer term in the traditional track, and Term 3 is, as a result of it being a summer term in that traditional, it is not a term in which nursing courses are offered. So in the summer term, you see Bio 186, Microbiology, or Bio 732, Health Science Microbiology, and also your SPC 101, which is Fundamentals of Oral Communication. This class, or these two classes rather, are again required with a C or greater in order to progress on to the next semester. Now, one important thing to point out if you're looking at this plan of study is that, as I mentioned before, Ankeny and Boone will admit every fall and spring. So if you are a student, you're admitted into the spring semester, that is term 1, right here in the spring. You would not have the summer semester down here. You would move your summer up and it would kind of lay right in here. So you just want to pay close attention to that. I really encourage students, as they're looking at the plan of study and they're kind of setting out on what their pathway will be for completing courses, that they work with an academic advisor to ensure that they're completing courses in the appropriate sequence. So those courses in Term 3, once those are completed, students will then progress on to Term 4. In Term 4, you see ADN 420, Health and Illness Concepts 2A, and ADN 450, Health and Illness Concepts 2B. These two courses are blocked courses, meaning that you will take one course at a time. ADN 420 includes a combination of acute care, inpatient, medical, surgical, clinical, as well as a pediatric clinical rotation. ADN 450 includes a component of behavioral health as well as acute care, inpatient, medical, surgical, clinical. Both of these courses individually have a total of 90 clinical hours. So in that semester, there's a total of 180 clinical hours. Additionally, there you see Bio 151, Nutrition. Nutrition is a course that is predominantly offered online, though there are occasionally face-to-face sections that are offered. But that course, again, must be completed with a grade of a C or greater in order to advance on to the next semester. Term 5 then is the last semester of the program. I really encourage students, by the time they get to Term 5, if there's any way possible that they go to work on an as-needed basis or consider dropping their hours at work, that is most advised because of the workload that falls within Term 5. So in the first 10 weeks, students will take ADN 520, Complex Health Concepts. This course includes a theory and a clinical component. It is 135 clinical hours. And that, unlike most of the other courses, is dedicated to one unit in the hospital, inpatient, medical, surgical, or likewise setting. So one specific place that students are placed along with their faculty member to complete that 135 hours. Once that 10 weeks is completed successfully, again with a C or greater, students will progress on to ADN 550, which is the professional nursing preceptorship. Within the preceptorship, students will complete 135 hours with a registered nurse, which they've been placed with. They will complete those hours in a variety of different places depending on the student preferences and also various other things that are taken into consideration with that placement. So it's 135 hours for that preceptorship. As I mentioned before, if you were to add up all of these clinical hours, that's a total of 675 clinical hours. So that is also something important to keep in mind. Lastly, in that semester, you see English 106 Composition 2. That course is required in that term in order to graduate. Again, you could take it prior to, but you would have to have successfully completed with a C or better in order to progress to graduation. You see here that the curriculum is a total of 84 credits, and that would be all of the pre-nursing and the nursing and co-requisite courses. I'm going to go ahead and close this one. Here is the accelerated program option. Again, this is accessible through the website. Same pre-nursing entry requirements. The one thing that I want to highlight here with the accelerated program is that if this is something that interests you, the accelerated track, I highly encourage that after attending this information session, you reach out to an academic advisor and sit down and really discuss your progression and your placement of these courses and what that looks like for you. Because of the fast-paced nature of this curriculum, it's recommended that our students will consider taking these red courses, these co-requisite courses, prior to entry into that term to lighten or lessen their load of those courses. So you can see here, as I mentioned before, this is a 5-semester program. It does go through the summer semester. The same courses are offered. The difference really is that summer term, but keeping in mind, again, the co-requisite courses and the importance of having those courses completed. So again, if this is something that is of interest to you, once you've attended the information session, I highly encourage you to reach out to the academic advisor to visit more about your plan of study and how you will complete these courses. Lastly then is our part-time program. Again, you see here the evening, weekend, part-time program, things are spread out a little bit more. There's one course at a time, and it does go through the summer semester. Again, it's highly advised, if possible, that you look at those courses in red, those co-requisite courses, and you complete those ahead of time, just to lighten your load while you are taking those nursing courses. So I'm going to go back to our PowerPoint here, and I'm going to skip through these. I like to pull up the full size so that you can see them. So just keep those plans of study in mind. If you have questions about those, please don't hesitate to reach out to me and let me know. My contact information will be at the end of this presentation for you. I mentioned a little bit earlier that our practical nursing program option is starting in the spring of 2019 on the Boone campus. The next offering will be in the spring of 2020 on the urban campus. This is entry requirements plus 2 semesters. If this is a program of interest to you, as I mentioned when I was reviewing the website, you would want to attend an actual practical nursing specific information session. So keep that in mind. So the goals of DMACC nursing really is to fortify our students' foundation through the addition of biology, chemistry, and math. Our goal is also to strengthen our curriculum to help better prepare our graduates for success. And that success is on the NCLEX RN, which is the state licensure exam, as well as further education for their bachelor's in nursing and beyond. So many of our students will graduate from the program, go straight on for their bachelor's degree. Many do end up earning their master's or doctoral degrees following graduation from DMACC. So that's very exciting, but we want to help make that a very seamless transition for you. So I'm going to go through our entry requirements and our support courses. Again, I'm going to be reviewing the program admission checklist, and this is accessible through our website as well. So a few things that you want to know before you begin. The recommendation is that you allow at least 1 year to complete the entry requirements. That includes all of those pre-nursing courses that I was highlighting. So recommended approximately 1 year to complete those courses. Remembering that the schedule of classes could include days and evenings. Face-to-face classes will be required. It's very, very important that you remember that flexibility will be necessary, and that recommendation that you check in with your advisor every semester. Now, I know that not every semester will be feasible for everybody, but just kind of that checks and balance to ensure that you're on the right pathway. Here I want to highlight for you, when you log into My DMACC and you go to Web Information Systems, you can access your degree works and see your progression throughout the curriculum, what courses you have remaining and what you have completed. Additionally, you can also see your program checklist here. So the items I'm about to highlight, you have access to see what you have completed. If you have questions about accessing that, please let me know. So I'm going to go through the program checklist here for you. The first thing that you want to do is complete an online DMACC application and select Nursing RN AAS as your major. So if you have not already applied, this is something I would encourage you to do early on. This does allow us to keep good tabs, if you will, or good data on what students we have in our pipeline, where they are at in completing their items, and contacting you if we have any surveys, questions, or seeking student feedback. So certainly apply for that program. Notify DMACC immediately if your name, address, or phone number changes after you apply. I'm going to highlight this information several times throughout this presentation, and the reason for that is if you fail to update your information, you will miss out on important information. So just keep that information up to date. Number 2 then, attend a required nursing information session. So you're in the session now. At the conclusion of this session, there is a questionnaire that you need to complete. There are 3 questions about the presentation today, and then some personal information that you need to fill out, your name, email address, and such. Without completion of that last piece, you will not receive credit for this information session. So please do ensure that once you have concluded this, that you are actively filling out that information for me. Number 3 then, submit proof of a high school graduation, GED, or equivalent. Contact admissions to verify your transcripts are on file. So if you've graduated from another institution outside of high school, you do need to also submit those transcripts, but we will require that you have your high school graduation, GED, or equivalent, as well as any post-secondary college transcripts on file. So make sure you have sent all of those, and just contact admissions to confirm that those have been received. Number 4 is a little bit cumbersome, so I'm going to just take a little bit more time to go through this. So if you are a student and within the last 5 years you've taken the ACT and you have scored a 20 or greater, you have completed this requirement and you really don't need to worry about the other 2 items. But if you completed the ACT more than 5 years ago or you did not score a 20 or greater, then you would need to meet the next requirement, and that is Compass scores of at least 81 in reading and 70 in writing. Compass has been phased out, so if you did not take the Compass or you did not receive those assessment scores, you would then need to take the AccuPlacer. AccuPlacer, you need to reach for a score of 73 in reading and 82 in writing. Those are the required scores. With those scores and that test, AccuPlacer can be taken through the testing center on any of our campuses, and there's information online about how to schedule that and what that assessment does entail. So just keep in mind, if you didn't meet the ACT requirements or the Compass requirements, then you're looking at the AccuPlacer scores of 73 in reading and 82 in writing. Number 5, you will complete the ALEKS math assessment to determine your math skill level and readiness to take Math 121, College Algebra, or Math 157, Statistics. Keep in mind that if you have already taken these courses, as I mentioned previously, you do not need to take that assessment. However, if you have not taken the courses, you would need to take the assessment for proper placement in those courses. Again, just that recommendation if you're trying to debate between the 2 courses. Many students will prefer statistics so that they can achieve that requirement prior to transfer to their BSN education following graduation. Number 6, submit proof of completion of a minimum of 120 hour State of Iowa approved CNA program or equivalent. Just a reminder, this does include basic and advanced CNA. Sometimes that is confusing for students. They think that they've completed basic and that's all that they needed, but you really do need to have basic and advanced, as it is both, they are both required. Number 7, submit proof of completion of nurse aid written and skills test for placement on the Direct Care Worker Registry. A transcript indicating that you passed both tests or a registry card will serve as that verification. Now, I get this question quite frequently where students will ask, I had taken basic and advanced, I was on the Direct Care Worker Registry, I have not worked in over 5 years, and I'm no longer active on the registry, do I still qualify? The answer to that question is yes, you do. You do not have to be actively on the registry, but you had to have been on the registry and in good standing. So if you have questions about that requirement, again, please don't hesitate to reach out to me and I can clarify that for you. So you'll complete the entry courses. As I've mentioned several times, you must receive a grade of a C or better, not a C minus, and submit documentation to admissions for verification. If you are a student that travels back home over break or the summer or any other time to take courses, you want to make sure that those transcripts are getting sent to DMACC so that you get credit for those courses. At the beginning of each course that you take at DMACC, you should receive a course syllabus that outlines for you how you will be graded in your course. It will tell you what percentage is equivalent to that C. In nursing, we use a standard grading schema. That grading schema, a 78% equals a C. Anything less than a 78%, that may be a 77.5 or a 77.8, anything less than a 78% without rounding is equal to an unsuccessful grade. So outside of nursing, you must earn a C in those courses in order for those courses to count in your plan of study. So must have a C in nursing. That C is equal to or equivalent to a 78%. We have a 5-year rule for science courses that must have been completed no more than 5 years prior to placement on the nursing waitlist. So the courses that are your pre-nursing, those must have been completed within 5 years of being placed on the standby list. Each course that falls within the plan of study, so the science courses within the program, must be no more than 5 years old at the time in which you reach that point in the curriculum. If you have reached a 50% or greater on the ATIT's science section, you are waived from that 5-year rule requirement. So keep that rule in mind. That really is intended to help fortify your foundation. So much of those science courses really is built on what we teach in the curriculum. So keep that in mind. We do also require a minimum cumulative GPA of 2.75 in the items listed below in 8 through 12. So only 8 through 12 are what is used to calculate your GPA for that requirement of 2.75. So number 8 is Introduction to Psychology or equivalent. 9, College Algebra or Statistics or equivalent. 10, Introductory Biology with a lab, keeping in mind here that that 5-year rule does apply. Number 11, Introduction to Chemistry. Again, 5-year rule does apply. Number 12, Anatomy and Physiology 1. And again, that 5-year rule does apply. So keeping that in mind, these courses may be in progress when your application is submitted. So also please do keep that in mind. On the website, if you go under nursing, you will see the GPA calculator. You can also just search up in that search box on the DMACC website, as I mentioned before, and you will get to the GPA calculator. Here you will include your course numbers or course name. You can call them whatever you wish, but you'll enter that course information, the total number of credits, and also then your letter grade. Once you've done that up here, you will hit submit. You'll hit submit, and down here you will see your calculated grade point average. So for this particular instance that we have included, the student's GPA would be a 2.78, which does lead to that 2.75 that is required. Typically, you can only get 2 C's in the sciences and must have A's or B's to balance your GPA to equal that 2.75. So just keep that in mind as you're completing those courses and you're considering what impact those courses might have on your overall GPA with these coursework. Number 13, then, you will complete the ATIT's Nursing Program Admission Test. As I mentioned earlier for you, on our website, off to that left-hand side, you will find the tab ATIT's. This provides you more information specific to taking this assessment. However, this is scheduled through the testing center. There is a fee that is associated with that, and that fact sheet is loaded on the website for you. Keep in mind that this assessment, you are required to achieve an adjusted individual total score of 60% or greater. You must remediate 30 days in between each attempt, and you are only allowed 3 attempts to reach that score. Students who have not been able to reach that score after 3 attempts will not be eligible to enter into the program. So this really is something that you will want to prepare for, and in the next slide I'll talk to you about how you can prepare for that. Number 14 then, once all of the above entry requirements in 1 through 13 are met, DMACC Admissions will mail a letter to you stating that you have been accepted into the nursing program. When a seat becomes available, you will be notified by admissions. Again, reiterating to you for probably the 10th time, if your contact information changes, please, please, please notify DMACC admissions immediately and keep that information up to date. It has happened in the past that we've gone to notify students of their admission, and unfortunately their phone number has been disconnected, their email is no longer active, and their address we receive return mail from. So keep those things in mind so that we can ensure that your seat's being awarded to you in a timely fashion. Number 15, you will complete a required nursing registration session. 16, you'll complete a required nursing orientation session. And then number 17, you'll enter into the program and begin taking your nursing courses. So in the next slide here, I'm going to highlight for you some important information about the TEAS assessment. So I already highlighted the required score of 60% or greater. That is a comprehensive adjusted individual total score that includes the areas of reading, mathematics, English, and language usage and science. So all of those must be taken in order to achieve that adjusted individual total score. As I mentioned previously, you'll have only 3 attempts to achieve that, so you really want to ensure that you are preparing. To do so, you can use the ATI study manual to assist you in your content review and practice tests. The book is available for purchase online through atitesting.com. There are study manuals on reserve at the campus libraries and at the Ankeny and Urban Academic Achievement Centers, as well as several other academic achievement centers throughout the district. You can also purchase online practice assessments. The website to do that is located here. DMACC students may visit their campus academic achievement center for also interactive instructional support using the ATI study manual. And then lastly, there's a resource, My Learning Express. This resource is currently being phased out, but this is an online prep tool for current DMACC students to help prepare for the TEAS. So keep in mind that last resource will be phasing out, but the other resources will continue to be available to you as students. If you're waiting, a lot of times students will ask, I'm waiting to be admitted into the program, what else should I do now? So take the required support courses to ease your load once you're in the nursing program. Bio 173, the AMP2, keep in mind that 5-year rule applies. English 105, Composition 1, your Psych 121, Developmental Psychology, Bio 186, Micro, keeping in mind again the 5-year rule applies. SPC 101, Fundamentals of Oral Communication, your Bio 151, Nutrition, as I mentioned earlier, that is predominantly offered online, though there are some face-to-face offerings of that available. And then lastly, English 106, which is Comp 2. So you're in the program, now what? So I really recommend, again, that you look back to that plan of study and look through what is done in each term, as I've kind of highlighted for you at the beginning, and consider taking those courses ahead of time, as I mentioned previously. So our program principles, I just want to highlight for you what our goal is. Our goal here at DMACC Nursing is to prepare our students to enter into practice as competent generalists. Graduates are able to safely care for patients in many settings and care models because they are exposed to many facets of nursing throughout the curriculum. We do not focus on creating med-surg nurses, OB nurses, psych nurses, or etc. Really, this means that students are able to explore interests and begin working in a variety of areas once they graduate from the program. We are founded on modern nursing practices. Our students are taught about nursing science and to think critically and become good clinical decision makers. They do engage in interprofessional training activities that allow them to work alongside medical students, pharmacology students, respiratory therapy students, physical therapy, occupational therapy, and etc. We do utilize a wide variety of technology throughout the curriculum. DMACC Nursing uses electronic textbooks and learning resources to ensure that our students have the most up-to-date information. We use interactive software to learn in class, lab, and clinical. We have a state-of-the-art simulation lab at our Des Moines Capital Center where students engage in high-fidelity simulations. This allows our students to gain confidence and insight in clinical challenges. prior to entry into the clinical setting. They can also take that information with them when they enter into practice. I will also say that many of our clinical agencies are now starting to use simulation as a means of interview. So this does allow our students the opportunity to have exposure to that prior to that employment opportunity. Lastly, we use active learning. Our students are expected to come to class with a basic level of preparation that they've gained from the readings and pre-class activities. The objective of class, lab, and clinical time really is spent applying the learning under the guidance of faculty and not just sitting there and being talked to by a professor. So really is an interactive environment, and the students have really shared a lot of positive feedback about that. Successful program completion, as I've mentioned a few times, requires that students have completed the courses in the designated order. They've completed all required program coursework with a C or better. As I mentioned in nursing, that C is equivalent to a 78% for a final grade. We do not round, so 78% equals a C, keeping in mind again that you're looking at your course syllabi for any courses outside of nursing to equate that C. Lastly, meeting clinical attendance requirements and achieving a satisfactory summative clinical evaluation. So a few things I want to highlight as far as special circumstances go, and these come to us through the Iowa Board of Nursing. If any of the following apply to you, please make an appointment to discuss your situation with the nursing program coordinator located on the Ankeny campus. If you have a nursing license that has previously been denied, suspended, or revoked, if you have criminal convictions including deferred judgments and expunged cases, if you have a criminal history of alcohol or drug-related offenses, or if you have been dismissed from employment for a HIPAA violation. Depending on your situation, you may be ineligible to participate in clinical experiences and or may be ineligible for licensure following graduation. You need to speak with somebody about this before entering into the program. So reach out to the program coordinator, again, located here on the Ankeny campus. So what can I do now to prepare to help me be successful once I've entered the program? There's really a variety of different things that students can do. One of the biggest is academic preparation. Really spending time, dedicating time, energy, effort to that academic preparation leading up to your entry into the program. So those are those prerequisite, co-requisite courses. Really working hard to ensure you're understanding that information. Again, it's a big foundation to your nursing career here at DMACC. With that, I also encourage students to begin to learn how they learn. Are you an auditory learner that learns by listening? Are you visual? Are you hands-on? Helping to really hone in on your learning style can be very, very important in helping you to be successful. So academic preparation, also just what are your strategies for studying? How do you study? Are you a good test taker or do you struggle with that? What resources are available to help you further develop in those areas that maybe you've identified as a weakness? Secondly, finances. Working to establish a budget, working to establish a way to really decrease some of the stress and anxiety that often comes related to financial resources. So I always encourage students to work and save money prior to entry into the program to really be able to kind of cut back on those work expectations once they enter into the program. We do have a pathway navigator. Her name is Sue Mixdorf, and she is an exceptional resource to help students when it comes to budgeting, reviewing financial barriers, or working with you to kind of understand what options may be available to you as a student. The third item that you see here is family. To me, family really is an important foundation to much of what I do, and I think many of the students in our program feel the same way. With family, you really want to ensure that everybody's on the same page. You've visited about your expectations. They understand some of the constraints that you might have with time and things outside of class. And really, you just have that support there for you. And then lastly, it's work. With work, we recommend that students are working 24 hours or less in a week. We do recognize that not all students will be able to kind of fall within that category, but we have learned through data that we have available to us from our students that the less students work, oftentimes the easier it is to be successful. So keeping that in mind as you work throughout the program, it's important. Financial matters, it's a fixed cost is your tuition. So tuition's a fixed cost. It's $156 per credit hour for 2018-19 academic year. We also see the inclusion of your computer and online fees. We do have some varied costs throughout the program. Those may include Castle Ranch immunization tracker and background check fee. It's on average about $82, and that's a one-time fee. Nursing textbooks that are approximately $1,200. That's the total cost for the program, approximately. Uniforms, shoes, and other special equipment that's required, approximately $550. Testing fees and simulation supplies is approximately $245. Curriculum support, assessment, and the review course is approximately $900. History and physical exam is approximately $240. BLS CPR certification is approximately $120. The licensure exam fee is approximately $350. And then the graduation pin, we do supply for all of our students graduating from the program at this time. However, students are also offered an opportunity to purchase their own personalized pin, and that's approximately $30 to $115. The total approximate for that is $14,100. So financial aid, that's important to kind of know what those limitations are. Students are considered full-time if they're enrolled in 12 or more credit hours. They're considered part-time if they're enrolled in less than 12 credit hours. However, I do highlight that you are still eligible for financial aid as a part-time student. That's kind of a misconception that students have had in the past. So you are still eligible if you are part-time. There is also scholarship opportunities. DMACC Foundation is one great resource for that. There's one application you could fill out and select various scholarships that apply to you through that foundation scholarship application. Additionally, employers oftentimes will offer scholarship opportunities for their employees, and then just basic internet searches. There is some information about scholarships loaded on our DMACC Nursing website, so you can click on that there. I know that Littman Stethoscope and Tylenol are two very good scholarships that are offered to students that you can apply for. Many times students will not apply for scholarships because they feel like they don't have a chance, there's too many people applying, or things like that. I will tell you that's generally not the case. I recommend as you're writing that, usually it's a paragraph or two that kind of speaks to why you feel you should be awarded a scholarship. Oftentimes you can utilize or recycle, if you will, that scholarship essay for other scholarships. So keep that in mind. You may have to make some minor revisions to make it applicable to a specific scholarship application, but it's not always about recreating the wheel for every single scholarship you apply for. Getting ready, just a reminder that nursing school is a full-time job. Research recommends that you should study on average 2 to 3 hours for every hour that you spend in a theory class. So keep that in mind as you're kind of structuring what your week looks like, how many hours you're working, and what demands you have placed on yourself outside of school. Clinical and lab do also require significant preparation. The nursing course credits don't make you a full-time student, but you will keep very busy. We don't recommend that you take extra classes just to get yourself up over that full-time status. Build your support team. Find people around you that are going to build you up. They're going to support you. They're going to cheer you on. Faculty, administrative, and staff here at DMACC Nursing all will be that support team for you, but it is helpful for you to also have a support team outside of school. Make plans now to decrease your work hours. If you have children working on backup childcare options, I recommend a couple of options just to ensure that you have coverage. Plan ahead and start saving now. And then lastly, just be aware again of that minimum passing score, 78% or a C in nursing and support and co-requisite courses. And then keeping in mind you have 2 opportunities to restart in the nursing program. So you enter into the program and then you have 2 opportunities that you can re-enter into the program if you were to be unsuccessful due to academics or just personal life happening. So just keep that in mind. And with that, if you have any questions, please contact me. Again, my name is Natalia Tilchis. I'm the District Nursing Coordinator here at DMACC Nursing. My email address is natilchis@dmac.edu. My office phone number is 515-964-6485. So that's my contact information if you have questions. Again, a final reminder that if you have attended this session and you wish to receive credit for attending, you must complete the quiz, which can be accessed by following the link below. So at any point in time, you can pause the screen so that you can get that URL written down so you can go ahead and complete that. If you have questions or concerns, please do not hesitate to reach out to me. Thank you, and we look forward to seeing you here within our nursing program.